Hi, I'm Jim.
I'm Renda.
We are Hardiness Approach.
Today we're going to kind of take you on our journey of how we found out he had prostate cancer and the different tests and scores.
So come along for the journey ride.
So the very first thing is the PSA, and probably of all the things that anybody knows about is the PSA.
You hear about that a lot.
And Jim, it stands for?
Prostate-specific antigen.
Okay.
And an antigen is, it's what is there that tells your body something's wrong here, you need to fix it, and so it brings in all the fixing stuff that bodies do.
That was really good.
Is that layman enough?
That's
okay.
Really. So men should be able to have their PSAs checked probably starting 40, 45. If they have any history of it, 40. 45 if they don't, history in their family.
So 50 if there's just normal, if there's a history, 45, and if they are black, 45, because there's a higher incidence in blacks.
Right, there are. Okay, so the PSA is supposed to be, well, it should be 0, but between 0 and 4 is kind of considered normal. Yeah. His very first one that we found was a 4 years ago. Then the next one that they found, just a few months later, was
a 7.
A 7. And that was while we were in Missouri.
Alarm bells.
That was while we were in Missouri. His right now is 21.9, or as the doctor said, 21 and some change. Pretty high. I guess if you have full blown, it can be 3,000 or something. I have no idea, but anyway, I don't ever want to see that.
Yeah, we're not going there, hopefully.
So that's one of the tests that is a flag. So after you have that, then they want to do a biopsy.
You know, before we go on to that, let's talk about what we learned about that as the reason that they need to do more is that although PSA can indicate that there is prostate cancer, it can indicate a lot of other things as well in the absence of prostate cancer. So they need to do additional looks to be sure what's going on. Is it the first big concern is cancer.
So men, first of all, men are the only one that has the PSA because it stands for prostate.
Well, besides women, who else?
But as men age, it automatically goes up. As
a little.
The prostate enlarges with age, it goes up. If you have prostatitis, which he does, it goes up, which is an inflammation in the prostate. Genetics can make it go up, diet can make it go up, lack of exercise, abdominal fat and weight can make it go up. So there's a lot of things that can make it go up without it being cancer. His was a flag, so then the next thing you go to is a biopsy. Well, he had a...
During the first round, when it was a 7, had a biopsy.
And the biopsy then is just 12 needle sticks, random needle sticks, in the biopsy, in the thing. So they don't know if they're getting it or not.
Shots in the dark.
So this time, thankfully, the doctor said, we're going to start with an MRI. And that MRI...
And that's a pelvic MRI.
Yeah, shows the pelvis and so the lymph nodes, different things like that around there. And so they read it and they could see 3 different lesions with one of them possibly spilling out or right at the edge.
And that's on the prostate itself.
On the prostate. So now, when they do the biopsy, they know how to do it.
Yeah, he knew right where to do the needle sticks. So he did fewer needle sticks.
And more direct to what he got.
And right where they needed to be.
I would ask him to explain how comfortable that was.
I don't ever want to do it again, and I've done it twice. And it wasn't the worst thing I've ever gone through, but it ranks up there with going to the dentist.
That's how much we like the dentist.
Sorry for all my dental friends.
So when they did the biopsy this time, they were able to actually get cancerous tissue and look at it and be able to go to the next level, which is to score it. But let me back up one. Before they did the MRI, the other thing that you do is a DRE. It's a digital rectal exam. And that's fun too. And so they go in and see if they can fill any nodules.
All I can say is find a doctor with small hands, smaller fingers.
Well, that's what women have been saying for years, so we feel your pain. Jim's nodules are on the very top. Like if this was the prostate, they're up here. So when you're going in down here, you can't feel it. In fact, the doctor who has done it last, he goes, "You don't want me to go up as far as enough to feel it." I'm like, yeah. Anyway, so we have the PSA, we have the digital exam, we have the MRI, and now we have biopsies. So we have 4 different things. The biopsies get scored, and they are what's called the Gleason Score. So they take the tissue and they compare that tissue against normal tissue, a little worse, and really bad tissue. And they say, where does it land? And then that's the first score. So they say, okay, it's going to land in the 3, so we're going to give that a 3. Then they look at it and say, how much of that tissue is that 3? And then they label that. So he had one that was a 3 plus 3 equals 6. And then he had one and that's low.
Yeah.
That's watch it. We're not going to really do anything
Observe
with it.
for a while.
It's called surveillance.
Yep.
Then he had one that was a 3 plus 4 equals 7. That's considerable favorable mid-range, intermediate, favorable. Then he had one that was a 4, it was in the poorer area, plus 3 equals 7. That's in the unfavorable mid-range or intermediate range.
Yeah, we're going to stop watching and do something.
Yeah, so when he got to where we're at now, and we're not even going to let you know where we're at right now, but when he got to where we're at right now, he has a PSA of 21.9. He had the digital exam that didn't show anything.
Enlargement.
Just enlargement.
To be expected at my age.
He had an MRI that showed 3 lesions, and he had a Gleason score of those 3 Gleason scores. When we came where we're at now, they asked to have the tissue sent up, so he did not have to have another biopsy. They had their very experienced pathologists look at it, and they came back. The 6 was moved to a favorable 7. The favorable 7 was moved to an 8, so 4 plus 4 equals 8. And the unfavorable 7 was kept at the unfavorable 7.
It stayed the same.
So now we've got
2 unfavorables out of 3.
and a high, and the 4 plus 4 is a high, equals 8 is considered high risk. So that's where we're at with that.
This is kind of moving forward from where we are and telling our story right now, but what we've learned about the PSA grading, the Gleason score, is that it's for predicting how things might be. It's not ideal. It's like using a shotgun instead of a single bullet kind of thing. You're probably going to hit it, but you're hitting a lot of other things at the same time. So it's broad, and the doctor we're working with suggests that it works, but not very accurately, and he wants to be more accurate and tending to work with additional facts instead of this generalized score, and that's the direction that he's moving things in right now. With that, and this is not in your notes that you were going to have us talk about, Is it okay if I jump ahead to that?
Absolutely.
With that, what he's doing is taking the tissue and he's doing some genetic testing of it. And with that, he's going to be able to determine, based on what he sees there, with the type of cancer it is, with whatever else they can measure in it, what the
growth rate.
The growth rate, it's going to influence
the treatment
plans that are created as a result of the information he
Right.
gets from that.
Right.
So, we're going one step beyond the PSA and getting
And the biopsies.
and the biopsies, and getting specific information about my cancer, so that they can make a treatment for me, not just this. People who have this grade should have these things happen to them.
Right.
It's going to be Jim Wilson needs to have this kind of treatment because of the situation that he's dealing with.
Right.
So
then the last couple of years, they have invented, they've got something that's pretty amazing. So the next step that has taken the question out of all of this is a PET scan, but it's not just any PET scan.
We had to change locations because the battery ran out of our sound. So it is what it is. But we had given a whole bunch in that other one, so here we go. The next thing that we were going to talk about is the PET scan. And there's a different kind of PET scan that's come out in the last couple of years. It's not a different type of PET scan, but it's a different emphasis is put on it, called PSMA, prostate specific membrane antigen.
Antigen, yes.
So there's another antigen.
Yes.
And what happens is, when he is getting in the PET scan, in his IV, they will put a tracer, some type of tracer in there, so that, well, let me back up. They're going to put a tracer in there. Back up. Prostate cancer likes to go to lymph nodes and bone. It likes bone.
When it gets out of its
When
casing.
it comes out, if it's going to metastasize. So if it goes onto the bone, it is not bone cancer. It is prostate cancer on the bone. So PSMA, PET scan, the tracer that they put in has an affinity to the prostate cancer, and it will just light up wherever it is. We hope it doesn't light up at all, but wherever it is in him, it just... And that way they also know how to treat it because they know where it is.
Where to treat it.
Where to treat it. Well, they know how because they know where.
Yes.
Yes. So he is actually part of a
Study.
research study. And so he's getting 2 PET scans, 2 different types, one on Tuesday, one on Wednesday. And at the end of that time, then...
As if one's not enough.
then we will find out...
What are we going to find out?
if it's metastasis.
Yes.
Yeah.
Which we want to find out that it's not metastasis.
Correct. Now there's another video that's going to come out before we find out about the other one. We won't find out for
Right.
a while, so you'll have to tune in. But this is a real breakthrough, and so
What's the other video going to be about?
the other video is going to be about what it is that we have done, what we have done for our care.
What we've learned, how we've cared for ourselves.
How we've cared.
Okay.
Yes, that's what it's going to be about.
I'm excited to hear that one.
I think you were there.
Probably.
Now I forgot what I was going to say. That's okay.
I do that to her all the time.
So therefore, all of the other 4 that I just talked about, with this PET scan, this PSMA, that's going to give the doctors a complete picture
Right.
of everything that needs to be done for his particular.
And with them having a complete picture, they're able to consult with us and tell us the options and the choices, the side effects that we can expect, the duration that we're looking at, the risks that are associated, the short-term, the long-term effects, and so we can choose what we want to live with.
So one of the things that I'd like to tell you at this point is that I'm a holistic nutritionalist, and so we definitely believe in the power of food.
Food is medicine.
It is. And
We didn't make that up.
my sister had subscribed a long time ago to Chris Beats Cancer. I think his name is Chris Welk. And so she had his book. And so we've been looking at that. He's been doing a lot of juicing. And we have changed our diet completely. Even though we were already eating good, we had cheated a few times, like a lot, in the last 2 years. And
But in addition to that, we've changed the ratio of plant-based food.
that's what I was going to say.
Yeah.
Is we are doing mostly a plant-based food. If we do meat, and we do once in a while, it is grass-fed, our grass-fed meat. We've been eating a lot of fish. We get our fish from
Alaska, something
yes.
or another.
Yes. Alaska Fish Company. Not Alaska Fish and Seafood, but Alaska Fish Company. And we get it probably every month and a half, and we've been eating a lot of fish because that's really good for him. We've learned a lot about nutrition, even more than I knew. Always learning. We know that cooked tomatoes are one of the best things for him. Things that we avoid, we're eating 0 sugar, no dairy. What else are we completely not eating? Oh, absolutely no processed meat whatsoever. Anyway, we've both dropped weight because we've started eating healthy and not eating the crud
But the intention is to be sure that my body has all of the helpful nutrients we can possibly put into it to improve my health and to fight against in any way it can, as these androgens are showing up, as to fight the struggle against them. And anything we can learn that can help us do a better job of that, we're actively seeking that kind of information, and through our own study, through what we're getting from where we're going here at the
Nobody knows what we're doing yet.
oh, okay. You will find out. But a lot of education going on, and very helpful. There is conflicting information, and it's tough.
No.
It's tough to weed through that, and we're doing some picking and choosing. And actually, some of what we've learned, we've had to do a little bit of unlearning. But part of it is almost every food that's good for you has good as well as some bad. And sometimes that has to do with taking it to excess, and other times it just has to do with the fact that along with good there always comes some bad, and you find a balance in there. And what we're doing now is finding some of the foods that have been good for us in one way have been bad in another, but bad in ways that are
Damaging.
that they actually feed and help the cancer. And so even though there's some good we could get out of it, we don't want to take the risk of it encouraging the cancer to grow. And
We'll be doing
Yes.
the food ones so that we'll be able to share that.
And we realize that there's a lot of information, but there have been a lot of studies done, and most of the studies that we're reading about, they can't say specifically, definitely, if you do this, you will get cancer. But what they're finding is that a high percentage of people who eat those foods have the cancer.
Association.
It's an associated thing. So, yeah, it's not 100%, but it's an indication, and that's enough to get our attention.
So one other thing, Jim was diagnosed with low vitamin D some time ago. Well, come to find out that almost every prostate cancer patient is low in vitamin D. So there's just so much to learn about and do.
Yeah.
Anyway, keep following us. You might learn, and hopefully if you're going through this too, we can answer some of your questions. And
our desire is to give those of you hope who need it, that prostate cancer is not a death sentence. It grows slow and it's very curable as long as you take care of it. You ignore it, all bets are off. But that's what we're learning, and that's by bringing you along on this, sharing, being open, helping you know that there are answers, there are possibilities out there. Hopefully, in some of what we say, there can be some little nuggets that can help you, can encourage you, can make you aware of things you didn't know.
thank you guys.
Keep watching.